My name's Kathy Rodine. I'm the Director of Acute Care at Sharp Memorial Hospital.
My name is Tracy Wynn. I'm a staff nurse on 7 West, a progressive care unit at Sharp Memorial Hospital.
My name's Judd Filer. I'm a physical therapist here. I'm a lead physical therapist for our acute PT team.
My name is Courtney Robeson. I'm the manager on 6 North as the surgical acute care unit at Sharp Memorial Hospital.
Oh, I think Umano has been very responsive, has been very interactive, has been worked with us on our needs, has been a great partner. I was at a conference for nursing leaders and saw the bed. And I think having the hands-on and looking at it, I thought, wow, this could really work in terms of our throughput, because we have issues with patients needing to be transferred into different beds, different needs, and having delays related to that. And at the conference, I had several people come up and say, Kathy, you need to get this bed for us. They wanted this bed because we could use it for a lowboy bed. They liked the fact that it was an easy bariatric bed, that it didn't look clunky, and that it was easy to maneuver. So we came in and we had a pilot, and we trialed it on our bariatric unit and then one of our medical units for a period of time. Staff liked it. I had people fighting about who was going to be able to use the beds. And so we made the decision that we would purchase a selection of the beds. Innovation, versatility, and responsiveness.
I think easy, accessible. I think it looks sleeker, newer.
Whenever we needed something, they were there. Making sure that the staff understood, that our supply chain people felt very comfortable with the process, that we had the correct pricing, and that we had the support we needed to make a good decision and then to be able to follow through on that. This is the only bed that I have found where we can find everything that we need for an acute care patient without switching to a separate bed. For our larger or taller patients, is that it looks like a normal bed. It doesn't look clunky. It doesn't look like a bariatric bed. In the past, we had patients who needed a larger size bed, but really balked at going into them because it looked different. And this looks like a normal bed, just a little bit wider.
So we usually had one type of bed for our entire floor, but when we wanted a specialty bed, we have to call from downstairs to make it a low bed or a bariatric bed. Sometimes it would take us hours for them to bring the specialty bed to our hospital and then bring it up to our floor, and that took a while. Well, my favorite thing about this bed is that you can change it into a low bed and you can change it to a bariatric bed, and it's really easy to do. You just push it out, or you do a little crank, and then you just add the extensions. And patients really liked that, especially if they were tall or if they were a little bigger. And I also really like too, when you pause the alarm, how much time that gives us. So one of my patients, for example, they need to go to the restroom. I really liked the feature on the bed to do a care pause when we have the auto arm feature of the bed on. But it's also nice because our old beds, the pause time was really short, and this one allowed enough time for our patients to get up.
So some of the specific features in the Umano bed that I have found much better is the rail, for example. The rail is so much easier to use, it takes almost no force, and there's no pinch points, which was problematic for us previously.
Not having to switch out the beds and the mattresses for patients, it's huge. It's money, especially with the height. I mean, I've never seen a bed that's able to accommodate patients that are at the heights that this bed can do.
There's a couple features that I really like on the bed is the turn reminder. It really helps because sometimes you're not always on the dot, so if you have the little reminder on, you can see approximately what time you turn the patient, and then you can say, oh, I should turn them now, or I can wait a little longer. Well, and using the change equipment button allows us to easily weigh our patients without disrupting them in the middle of the night, which is we usually weigh them around 5 in the morning, so we can do it in the bed without worrying about the weight discrepancy.
And I love the boostless backrest feature, because now you can raise the head of the bed for our patients appropriately, and you're not getting skin shear, and they don't slide down in the bed. Their pelvis stays in place as you bring their head up, which keeps them more comfortable and eliminates repeated high-risk task of having to boost the patient up in bed.
The beds have a spot for the patients to plug in their own electronic devices, so especially with millennial stages, everyone has an iPhone, an iPad. They like to keep their things close by. They're afraid of losing them, so you're not having a bunch of cords that then create a tripping hazard for the staff or the patients. Everything's kind of close by.
Because it's easier to mobilize patients, it's been very helpful. We can put the bed down to the level that's best for the patient to be able to bring the patient up and help them ambulate. It also has helped in terms of for patients who are a safety risk, that we can lower it all the way down so that they don't fall out of bed. We have had them on 7 West for about 6 months at this point. Did a staff survey, found since using the bed that we've had no bed-associated falls, and we believe that we have actually seen an increase in people using the low bed function because it's readily available there on the bed. They don't have to call for a bed or wait for a rental bed to come to be able to put the patient on. They just use the features that are already there on the bed.
As a physical therapist, I think one of the best characteristics of the Umano bed is when I need to mobilize a weak patient off of the bed, because the bed will go low enough for patients of shorter stature that they can get their feet firmly on the ground. And having that 5-minute pause feature is so much better for our patients to allow them the time that they need before they can mobilize off the bed.
I think it's really easy to use the bed. I liked the screen in the front. There's a lot of colors that you can change to, and I like how visual it is. I'm a visual person, so that really helps.
It's intuitive, it's colorful, and it's easy to use. All of the interface is in one place for staff to use, and staff have repeatedly commented that they think that the interface is spot on.
I find it very easy to use. Sometimes people come to me to troubleshoot if they're, when the first time that you're trying to get the bed to be wider, but once you do it once, you know how to do it.
They find the ability to move themselves in the beds very easy, and they find the bed very comfortable.
The first thing I heard from patients when they were in our previous beds and then in these beds was how much more comfortable they were. This bed is far more comfortable for a patient to sit at the edge of the bed. They don't complain of the frame digging into their legs.
We have one patient that has been in and out, and they always ask for the Umano bed. It's high comfort. It's easy for the patients to use. It's not confusing. Sometimes on other beds, you'll have multiple controllers that move the bed up and down. It's easy use for the staff and easy use for the patients.
I think the biggest advantage for us is that it can cut down on the time to get the patient on the appropriate bed. Is that if we have the patient on a bed which can be modified easily in place versus waiting for another bed to be delivered, to having to move a patient from one bed to another bed, and then having to get rid of a bed that's sitting in a hallway makes a big difference. We monitor our throughput from the time a patient gets from the emergency room up to a patient room very closely. And with that, in the past, we've had issues in terms of having to wait for the appropriate bed to be delivered to the room, which might have taken up to 4 hours. At this point, we were able to just use our bed.
Especially with my patients who are really tall, every time I expand the bed, they are so thankful for me. They're like, wow, I can do that? I'm like, yeah, I'll just make it a little longer for you. And they're like, why hasn't anyone showed me that? Changing it to a bariatric bed, my patients are very thankful, and they don't have to get out of bed necessarily for me to be able to do that. They're very thankful about that too.
For us as a hospital staff, having one bed that meets our bariatric patient needs, our extra wide bariatric needs, our long bed for a tall patient, our low bed for a patient high risk of falling, allowed us to be more reliable and have more staff competent quickly. It allowed more patient-centered care and more safe care because now we're using the same bed for all of these different patient types.
Easy in terms of answering questions and finding resources and just using the bed.
Overall, I enjoyed my experience with the Umano bed and receiving the Umano bed, getting training on the Umano bed. It's really helpful too. They added little laminated cards when we first got the bed to the foot of the bed, and that was really helpful too as a kind of reference guide.
I felt like it was a partnership. I've really seen our patient satisfaction go up with these beds.
Everything around the Umano experience has been excellent. The team actively listened to what we needed as a hospital. They were very flexible with the scheduling and meeting in-servicing needs 24 hours for all of our staff. A phone call, you guys were immediately here. We have an experienced staff that is very tied into patient-centered care, and this bed has unanimously been met with positive feedback.